Mumps, measles, rubella. Starting with mumps, it's a systemic viral infection. So, all three, whether it is mumps or measles or rubella, all three are viral infection. And mumps, it is having this feature that is swelling of parotid glands, and it is endemic worldwide. That is, it will be localized to a particular area in a country. Moving on to the clinical features, mumps peaks at the age of 5 to 9 years. That is, it affects mostly children, and the infection is by respiratory droplets. It is the same for all three. Mumps, measles, and rubella all are spread by respiratory droplets. The incubation lasts 15 to 24 days, and the characteristic feature is initially the patient will have pyrexia and headache, which will be followed by parotid swelling, which will be tender in nature, and the parotid swelling will be bilateral in 75% of the cases. The diagnosis is done clinically. What are the complications? Epidermoorchitis, that is the swelling or curving of in the testicular region, mumps meningitis, encephalitis, transient hearing loss and labyrinthitis, and spontaneous abortion. How can we treat it? Analgesia for the symptoms is basically sufficient, and we all know there is MMR vaccine, of which mumps vaccine is a part, and this has reduced the incidence of mumps. Moving on to measles. Measles is also known as rubeola, and again viral infection. It's only seen in humans. The infection is by respiratory droplets, and the incubation period is 6 to 19 days, after which there will be a rash. So before this rash occurs, 1 to 3 ahead, prodromal illness will occur. Later on, the rash appears, followed by upper respiratory symptoms, then conjunctivitis, and a characteristic feature, koplik spot. Koplik spot is small white spots surrounded by erythema or redness on the internal buccal mucosa, and a natural antibody develops, and this maculopapular rash appears, and it spreads from face to extremities. In this figure you can see this is the maculopapular rash, and lymphadenopathy and diarrhea occurs. So this is the figure showing koplik spots. There will be this white color spots surrounded by redness or erythema. Complications are otitis media, bacterial pneumonia, encephalitis, and subcutaneous sclerosing panencephalitis. Management. Usually, in immunocompetent patient, the disease is self-limiting, but all these complications or severity increases as the patient is malnourished, or the more the patient is immunosuppressed, the severity increases. And pregnant women should be considered for treatment with immunoglobulin. Now the children who are aged between 12 to 15 months, they should be given vaccine, MMR vaccine, with a further dose at age of 4 years, and antibiotics is only necessary if there is a superinfection. Moving on to rubella. Rubella is German measles, and again it's a viral disease transmitted by aerosol. Infectivity is from up to 10 days to 2 weeks, okay, after the onset of rash. Incubation period is 15 to 20 days, and in most childhood cases you can see this disease will be along with lymphadenopathy, and maculopapular rash will start from the face and it moves towards the trunk. Greatest significance is that for pregnant women, transplacental infection may result, and thus a severe congenital disease can occur. Complications are arthralgia, thrombocytopenia, hepatitis, and rarely encephalitis. Management. In case of pregnant women, if we suspect rubella, we can confirm it by providing either by rubella IgM antibodies in serum or by IgG seroconversion. And in exposed pregnant women, absence of rubella IgG indicates potential for infection. Now, the children we were talking it from the beginning, they need to be given vaccination, MMR, and women of childbearing age should be tested and vaccinated if seronegative. That's all. Thank you for watching.